Without further ado, let me introduce the rest of the gang here tonight. We've got Jess Hofherr. She is a total rock star, amazing individual. We've got Erin Sanzone, another rock star, amazing individual. Continuing in that theme, we've got Shal Wilson and we've got BJ Hessler. So, ladies, why don't you just tell us a little bit about yourselves and what you're doing with us tonight, and then we'll roll right into some topics on injury and recovery.
Sounds good. Well, welcome everyone. Glad you're here. My name is Jess. I am a physical therapist. I have experience in both outpatient and acute care and inpatient rehab in the hospital. And I have been in the adventure motorcycle world for about 5 years. And you might have seen me on the Chattahoochee BDRX last year.
Hi, all. I'm Erin. Some of you have seen me train. I'm a physical therapist, or physical. I'm not a physical therapist. That's Jess. I'm a physician's assistant, apparently. I specialize in orthopedics, primarily in knee and hip reconstruction, but I've spent nearly 30 years in trauma and orthopedics. I'm from Connecticut, and I've been adventure riding under the tutelage of Shal and BJ for the past 5 years.
Hey, everybody. Good to see everybody here. I'm Shal, and among many things, today I'm representing being an ex-pro rehabber, meaning I have spent many years rehabbing from various injuries.
Hey everybody, I'm BJ Hessler, Northern Virginia area, and I have, similar to Shell, recovered from a lot of different injuries and am working on building my confidence back up for the big bikes by way of smaller dirt bikes.
Awesome. Right on, ladies. Well, thank you so much. I'm going to kick it off with Erin and Jess, and they're going to talk a little bit about the clinical side of injuries.
Well, we love the clinical side. So to kind of start off, I'm going to talk about injuries here. Aaron and I are going to set the stage of what exactly does this mean physiologically, and how should you think about the recovery process, and then we'll get into those specifics with Shal and BJ about what that whole picture of rehab should look like. So first off, what is an injury? And it's funny because you don't really think about that because if you get a paper cut, if you have a blister, if you have something that is disrupting that tissue and impairing function, if you're limping around because you've got a blister on the back of your foot and that hurts, then that is an injury. So this includes muscles, tendons, ligaments, bones, articular cartilage inside those joints, and your skin itself.
Yeah. Jess, did you want to talk a little bit about acute versus a chronic?
Yeah, sure. So acute injury is often traumatic, and with that trauma, it's like a 0 to 4 days. You have this inflammatory response, and that's when we get that pretty significant pain that you know that you have an injury, some redness, some heat, swelling, bruising. Your like cardinal signs of something going on with your body that you have
Mm.
physical damage. Initially, we have a cellular response and a chemical response because of that physical disruption. And we really want to emphasize that this is actually a good thing. You want to promote this inflammation and allow this phase to happen so then you can move on and get through more healing. And Erin's going to talk a little bit about what that looks like.
Right. So one of the things that, when Jess is talking about that acute injury, some of you guys are bleeders, right? Just like, everyone's different. Some people tend to bleed more than others. And one of the things that I like to tell everybody, especially with these acute injuries, where you can see, the ecchymosis or the bleeding or the bruising, um, your body your body loves to have blood in a blood vessel. Your body is chemically and pH balanced for blood to be in that blood vessel. When you have that acute injury, and if you're a bleeder, that blood goes into the soft tissues, and that does not chemically sit well. and it can become a chemical irritant. And even like when we do surgery, you're going to bleed, and that blood will pull itself out and down through the tissues, and it acts as a chemical irritant. And a lot of people always want to know, well, when's the bleeding going to go away? And there's no specific timeline. It's always 2 to 4 days, and then the bleeding goes away. Bleeding goes away by a percentage of what your body can resorb and break down each day. And it's only like 1 to 3 or 4% that your body can kind of clear out in a 24-hour period if you're doing, quote, all the things right. And it also can sometimes be encapsulated in something that we call a hematoma, and that takes even longer to break down. So that's just something to kind of keep in mind, why part of the reason why it hurts so much and it's so uncomfortable. And then that brings me to the NSAIDs issue. If you're on NSAIDs, if you're taking anti-inflammatories just on a routine basis, if you're like my dad who likes a Motrin every day, no matter what, you're going to bleed more because you're inhibiting some of the clotting factors and the platelets in your circulation system. So you're going to bleed more. And that being said, when you have an injury, we always tend to want to go straight to the Motrin, straight to the ibuprofen, straight to the Advil. Inflammation, although it has kind of a bad rap right now, like everybody's like, oh, you're all inflamed, you're inflamed, I've got all this inflammation. In the setting of an injury, inflammation's not a bad thing. It's a good thing. It sets the chemical reactions and the chain reactions for healing. So you don't always want to go for your NSAIDs. And I'm not saying don't ever go for them, but if you can pass on them, try. Let nature kind of take its course with some of these injuries a little bit, to let your body start to do that ligament repair, tendon repair, breakdown, cleanup, all of the things.
Yes, Erin, absolutely. I agree. And what I often tell my patients is sleep is the number one thing. We need sleep to recover. And if you're in pain all day and you're avoiding NSAIDs and you need one at the end of the day to help you sleep, then take it. It's not 100% avoid it, but
Right.
just be judicious and kind of understand what implications that has.
Right.
And then we also have chronic injuries. So just to mention something that like those nagging pains, you've been on the bike for an hour and your low back hurts. Those are chronic injuries where maybe you haven't had some sort of traumatic event or you have a history of an injury there. And those can be a little bit more complex. And this is my physical therapist plug. Having someone help you figure out why you're having that type of ongoing pain is a good idea. So just to give you a thought of where we are acute versus chronic. Now, for this chart that we have here, I love sharing this chart because it shows all of the different tissues that can be damaged in an injury. And all of these tissues have different timelines. So if you're looking at the top, that first 0 to 3 days, that's your acute injury. That's when it first happened, and that's when the bleeding, the cellular damage that's occurring. And then the colors are showing when do these tissues actually fully heal. So skin, 4 days to a year, kind of depends. So everything depends on what kind of tissue you're looking at. Um, your job is to identify what kind of injury that maybe you have experienced and try to think that there are different layers here that ultimately are going to guide that recovery for you. So I like to tell people in that, that first stage after an injury, like let pain be your guide. Like listen to your body. If you are popping vitamin I every 4 hours, 800 milligrams, and just ignoring it, that's another aspect that you're hindering that connection from your brain to your body when it's trying to tell you what's going on. So it's a good thing to try to get through this and
Right.
understand what kind of injury you have. So this is just a cool chart to show you that the worse you've hurt yourself, the longer it takes to heal. It's kind of a no-duh thing, but we're going to talk a little bit more about like lifestyle and what other things can you do to promote that recovery. And we'll hear specifically Shal and BJ's experiences as
Yeah.
well. And
Yeah.
go ahead, Erin.
No, keep going, keep rolling.
I was just gonna say that one thing to keep in mind is adventure motorcycle riding is a sport, and you are an athlete, and so you need to protect yourself before an injury occurs. And if you do get hurt, try to understand the full picture and help yourself rehab during that injury. So I just want to put that in your head. It's just a good mental status.
Right, right, right. So clinically, what do I see? That was my big teaser. I can tell you there's some three things that are in common with patients who heal and recover well, the things that happen with a good recovery. The first one, if you've done any of the fitness stuff with me, you know my love affair with muscle. And to have good muscle, you have to have good nutrition and protein. And it's even more important when you have an injury. When I have a patient who's just had a fracture or we've just done a joint, they start their day with me with 50 grams of protein in the morning. Just get it in, especially if you're a female patient. Men are a little bit better about eating more and having more hard protein based meals. Women, it's hard for us. That's a lot to eat. So you just hit it fit with 50 grams of protein in the morning. Try and aim for your body weight at least in grams of protein, but supplement if you're not getting there. So, that is one of the first things I always recommend. It's, you're asking your body to rebuild, and it's like asking a mason to rebuild with straw and some dirt. You need to give the man some bricks to build the chimney, right? The way our body's going to build those tissues is with those protein bricks. You need them. That's not the time because I'm inactive. I'm going to cut my calories. No. Prioritize your calories into protein so that you can rebuild. The other thing is sleep. And Jess kind of touched on this. Sleep is, without a doubt, if you ask me out of the three of these things, sleep is the most restorative and rebuilding time. If you're not getting adequate sleep, you're not going to heal quickly. Your healing timeline is definitely going to drag out. And you have to understand that during the day, you're up and you only have so much metabolic wick and metabolic energy that can go into something. You're up, you're walking around, you're making decisions, you're eating, you're thinking. That all burns energy. When you sleep is when your body does its very best restorative and repair work. It's during deep sleep that your body will release prolactin, growth hormone. It's during REM sleep that you will release testosterone, and women are notoriously low on it. And that is a whole nother Trailside about women and their testosterone. But that's the important time when your body releases the elements that you need to start healing. So I love sleep. The last thing that you need to heal and recover is you actually need movement under load. Yes, we immobilize fractures. Yes, we splint things, but we also get you out and get you into PT because we actually want you to start moving around that in a safe, protected way. But we need to start loading those tissues. When you load the tissue, that drives blood flow. Blood flow and perfusion are what clean everything up and repair it. I like to think of, and it's a long-term thing. If you look back at Jess's chart before, if you notice, there's a timeline on there. The reality is, if I see a big enough injury where it's not just like a skin abrasion, but when we're talking about a tendon cut, a ligament cut, a bone fractured, intra-articular, if we're in our joint, it almost always takes up to a year to get better. It takes almost a year and sometimes more, depending on who you were and who you are coming into that injury. So PT is kind of like the fire department when you first get injured. PT's in there, go to your physical therapist. But after 6 or 8 weeks, your insurance drops and you're discharged from PT. The problem is now the fire's out, but you're kind of stuck with this burnt out structure, right? That's when I always recommend people should go into a strength and conditioning coach afterwards. And you want to look for someone who's certified, and you want to look for someone who has experience and has received some training in corrective exercise. And you're going to stay with that person. Honestly, I'm a PA, I'm in orthopedics, I do all this fitness. I still see a trainer. I still have someone help me program. and watch me, because it's easy to get hurt. We're athletes, we're competitive. If you let me try and do it, I'm going to be like, well, I want to lift really heavy and I want to feel the burn. I want to get tunnel vision and I want to feel like I puked. Well, that's probably not the best thing, especially as we age or you're coming off of an injury. So it's really, really important to connect in with that kind of longer term help with coaching and muscles and movement. The other thing that I talk about is you need water. You can't heal your tissues if they're all dry. Think of a sponge. How easy is it to break a sponge in your sink when it's dry? It's super easy. It cracks, it flakes. Your tissues are really not much different. Trust me, I'm in the OR. I got my hand in there. They feel exactly the same. If they're dry, they're fragile, they're brittle, they're friable. So you want to hydrate them. I love vitamin D. If you're going to take vitamin D, take it with K because it absorbs better. I know a lot of people think with broken bone, I need calcium, I need calcium. You probably don't. What we see is a lot of people, as long as you're eating a really well-balanced diet and of whole foods, don't add extra calcium in. A lot of times that will add to your blood vessels, which is, nobody wants crunchy blood vessels. That's gross. So be careful with that. But I do like vitamin C for your skin, and I like omega-3. That helps. The next thing is, the use of tobacco and alcohol. These aren't moral judgments. It's just the reality. Alcohol, one, it inhibits your deep sleep, right? And we talked about how important that is. So you're losing sleep with alcohol use, and also it's a poison. The reason it feels so good is all the things that happens, when your body's trying to break down that poison from you dying from it. So that also diminishes healing. Tobacco, and this also includes vaping, right? It's the nicotine. It's the nicotine that's problematic for a wound and an injury because it's a vasoconstrictor and it doesn't allow blood flow, which is perfusion is life to these tissues. They need it. The tobacco will stop that. And again, we talked a little bit earlier about just too much emphasis on the anti-inflammatory. I also have my little woo section, and I say it's the woo. There is some good science behind all of these things, but if you're not used to looking at a little bit of alternative things, it can sound kind of strange. But there's some really good studies about red light therapy and healing, red light therapy with specific wavelengths that help actually muscle grow. I love saunas. People will use some peptides and some deep tissue massage to help with healing. But I would tell you that 90% of your recovery is your protein, your sleep, and your movement. These other things, the supplements and the woo, that's like the last 10%. So don't get distracted with the woo.
Erin, and I just want to point out all the things that you're saying, like 95% of this is in your control. So and the PT plug, you can find someone that knows how to work with athletes. So you can look up Google reviews. If you have the opportunity, search and find the right people who are gonna get you on track, and be open about what your goals are. Like, I want to get back in the saddle and swing my legs over where my hip doesn't hurt. So that's the last thing I'll say there.
Right.
No, you can keep going. Don't let me cut you off. I was like, oh, I can slide. It'll look so slick because it'll flow right into the next one.
Well, and it's really, there's so many things that you can do to help, and it's so good we're having this conversation, and it's so good that you guys are asking questions. We're all going through some sort of injury or phase or process where we hit these obstacles that we just need help with, and that's okay.
Right. And also with that, avoid comparisons. You are not your neighbor. You're not your girlfriend. You guys are different people genetically, historically, fit wise, injury wise, the way your body heals. Everybody heals a little bit differently. You cannot compare yourself to someone else. Each person's on their own journey. And I think one of the best things to do is look back at your own journey and say, oh, I'm not getting better. Well, are you better from where you were 2 weeks ago? Are you better from where you were a month ago? That's your only comparison. That's your only marker for how you're doing in your recovery for this.
And well said for the mental aspect of it. Stop comparing yourself to what happened before the injury.
Right. And again, you are an athlete. I know it's hard. Athletes are competitive.
Yes.
But I think we have Shal and BJ, right, Eva, that can talk about some more of the mental strategies of recovering.
I love it. I love it. Well, thank you from the front lines of the clinical defense department. I really appreciate all of your guys' insight. Ladies, don't hesitate to drop those questions in the chat. Like, you have access to like 2 people with like medical degrees right here. So drop them in there, challenge them, see if they need to go take their continuing education certs again one more time. But drop those questions. It's some really good chat stuff. And I've already seen a couple questions that I'd love to just answer for everybody happening in that chat. But let's just turn it over to Shal and talk a little bit about what it's like to have gone through some heavy duty stuff and to be a good patient.
Yeah. Well, first off, I want to thank Jess for that rainbow graph, because I now have a better understanding on some ligament damage that I had done to an ankle. And I think it's called, what did it list it? Interarticular, which, you know, is unlikely to fully heal. Well, now I understand why, because I'm dealing with that. But anyway, yeah, so the couple of things I wanted to talk about a little bit about the physical recovery as well as the mental recovery. And when it comes to the physical recovery, essentially do the work. I had, go back, don't go to the slide yet.
What? I thought you were gonna. I was trying to
Yeah.
you.
Well, I had 7 orthopedic surgeries within a year and a half time frame. And if any of you have rehabbed one body part, you have an inkling of what that might be like. So anyway, put in the work, do what you can. And yeah, like, had I not put in the work and done what the PT had told me to do, I would not be doing near the things I do in life right now. So I get a lot done in my days. But without that rehab, there's no way. I don't even know what I would be like. When it comes to the mental focus, basically focus on the things that you can do, not the things that you can't. Okay, so baby steps. For a long time, several months, I had a hand that was frozen like this due to nerve damage in my shoulder. And I would literally have to physically move every finger. I didn't even know if I would have the use of my arm. But I did what I could, and I didn't focus on the things that I couldn't do. So those are my 2 big tips on those 2 things. Do the work and then focus on the things that you can. All right, you could go to the crazy crash slides. Now this here, you guys, is back in January of 2011. And I don't necessarily think about this accident itself. I think about, or I feel my body, right? My body is the reminder of this scene. Significant crash, very low speed, what we would consider low speed, 25 miles an hour. Totaled the car, the bike, and essentially my body. Now, the previous slide said training is crash avoidance. Well, had I done any of the practicing that I was supposed to for the crash avoidance skills that they teach in a basic rider course, I would have never had this accident. I would have either done a quick stop or I would have swerved. But I didn't have the skills. I had been riding for 6 years. And a lot of us would consider that a pretty experienced person, but you're not experienced unless you actually practice the skills and practice often. So that's my plug back to training, being an instructor both on and off road. Take as much training as you can and then practice, right? Practice what they're teaching you. What else could I say about this? I don't know if you guys can see in the lower right-hand corner. Yeah, right there. That's me on the other side of the road there. At that point, you guys, my helmet came off and I actually split the back of my head open. So I not only had a lot of joint and injuries, but I had significant, help me with the word, brain brain fog, concussion, major concussion, lots of short-term memory, vertigo, like lots of injuries just in my head alone. The key thing to that is buckle your helmet each and every time you put it on. Don't wait, just put it on and buckle it. What was on the other part? Yeah, right there, small baby steps. Yeah, so getting back into life, like when I was able to start, joining the world again, I would often I would often do too much, right? And then I'd go, okay, I just overdid it. I got to kind of rewind and reel things in a little bit and take more baby steps. So that's kind of the key. You can't just join life like you used to. You got to, kind of baby step back into it. So, yeah, I guess that's all I have to say on that is to just, do the things you can and build on it, right? One thing after this major accident, just real quick, a thought that I had was I was curious how was I able to not only recover and still ride a motorcycle, and not only just ride a motorcycle, but literally live off my bike for a year and a half after experiencing an accident like that? And I feel like the answer I came up with was because I live a life that I'm always putting myself in, scary, uncomfortable situations. I was able to deal with that. So essentially, if you're always living life easy and comfortably, when life gets challenging, you might struggle more, right? So don't be afraid to get out and live. Live life, challenge yourself, scare yourself, right? Yeah, get yourself uncomfortable out there. Other key things, getting back on a bike. I think actually, BJ, you're going to talk to this, right? On going
Yeah.
into smaller bikes. Cool.
Yeah, and I would second everything that you've been saying. The idea of like being a person who goes out and takes risks regularly, I think kind of predisposes my future self post injury to getting back up and trying again. Um, but the psychological part of it has been really hard for me. I didn't have one catastrophic crash, but I've had several tough crashes, and some of you can relate. I was a hardcore athlete when I started riding off road, and I started on a big bike in the woods, and then eventually, after enough injuries and only riding part of a season every year, I finally took people's advice that had told me, maybe you want to figure out what you're doing on a smaller motorcycle. And I've been running my school now for 8 years, and there are plenty of women out there that I've taught how to ride, like literally their first day on the clutch was with me, that are now racing hare scrambles and stuff, and I'll never catch them because I've had all of this downtime in my injury recovery periods. And so when Shal was talking about the small baby steps, that's really where I had to bring my mental game back to, was saying, you know, I'm going to go out for a little ride. I'm going to go out for a little ride. I'm going to go out for an hour. And it helped for me to get the little bike set up. Instead of packing up the Africa Twin and taking some epic adventure that takes me a day to get to the start of it and another, 3 days straight, it became a van and a loop ride on a little dirt bike. So I could do just a couple of hours that were intensely physical, but then call it when I needed to, instead of being committed to a day after day after day journey, or having to have the ego checked enough to turn around on an out and back ride. I find that that's pretty hard to do when there's a goal already in mind. So trying to set myself up for success by having an easy out in terms of my day's schedule getting back on the bike. I've had both of my thumbs rebuilt, and I now have very short thumbs ups. It's very pathetic. My pinch strength sucks, but those were just genetic, shitty cards, and probably exacerbated by my lifestyle of always hanging on to a clutch and a throttle. But I have had that stuff fixed, and thankfully the grip hangs out right in the joint that's still kind of compromised. But the idea of working with what I can when I can't. When I was out with hand surgery, I got under a bar. I happen to use Planet Fitness a lot, and they put their squat rack in rails. So I didn't have to be able to hold the bar with both hands to be able to keep working my legs. I've had 2 major ACL reconstructions, one with MCL and cartilage and all kinds of bone burring and stuff like that. And while I was down for 2 months of no weight bearing on that surgery, I sat on the floor at the gym and worked the rope machines to try to still get some cardio and not let my body completely go to shit while I was mentally feeling sorry for myself. Because that, for me, they go hand in hand. And the mental piece has been huge, where, I really feel for people that don't have this as a living, because it's yeah, I'm a motorcyclist, it's part of an identity, but oh God, this is getting dangerous, expensive, scary, whatever. I'm sitting here going, oh my God, I have a mortgage. My whole life revolves around my body functioning. And I was like, what am I going to do? My first class on this new farm, I actually taught with a nerve block in my arm because my surgery got punted and I had to have surgery the night before I opened class. And it's like, what do you do? And I asked for help. That's the biggest thing, is that I had to humble myself from being this, I got this, I'm a, strong, independent woman, to being like, hey, can somebody help me? I physically cannot push a motorcycle in a straight line with one arm. I can't get them out of the barn, and being able to really reach out to people and figure out you find out who your real friends are when you live in the country and you need your ice pack changed regularly, right? So, but just the overarching theme for me has been taking very small steps to get my confidence back first and foremost. Somebody had mentioned in the chat the idea of being the weak link, and that is really hard on my ego, on my self-esteem. But I had a success story last summer. I joined Emmaus Moto Tours, does a lot of BDR tours on the Northeast and MABDR and stuff like that. And I did one where I was trying to go in covert, that none of them knew I was a coach. But of course, on the first welcome dinner, the guide told everybody that I was a coach. So I was like, oh, great. Now pressure's on, right? And I was on the Africa Twin, which was a bike I had not been practicing on at all season. And the very first day, everybody's running 60 miles an hour on gravel. And I took a turn too fast and kind of bonked my rear tire into a little bridge abutment over a stream. And I just pulled over and I told the sweep rider, forget it. I'm not even close to riding that quick. And it took so much swallowing of one's pride to tell the group, hey, I'm going to just ride as slow as I need to. I'll see you at the next corner, and we have the GPS tracks, and I'm going to be fine. And that was a 9-day trip, I think. And by day 5 or 6, I was also running 60 miles an hour. But it's because on day 1, I went down to 15 miles an hour on those corners. I went down to, oh, great, my cat just brought in a mouse. Oh, sorry. um, oh,
Let's talk about ergonomics.
Yeah, seriously. Let's take.
On that note, yeah, ergonomics, you guys, is huge. Setting our bikes up properly, right? So having your bike set up with proper ergonomics is going to help with you getting into proper body positioning, right? If it's hard for you to reach the controls and things like that, you're not going to be able to control your bike as well. So one of the things that I would try to encourage my students before class is to set their bikes up, whether it be the levers, you might even have to move the handlebars. I've literally had to adjust on my 1250 the clutch lever, brake lever, gear shifter, rear brake, like all the things, including the handlebars. So make those adjustments so you could then reach and use your controls easily. Okay, when we're, especially the levers, like when we're in a standing position, if your lever is rotated up and now you're standing, you're literally like this, right? So when you're doing a lot of slow speed maneuvers and you're in that position for a long time, you're gonna start having injuries, and I'm sure Jess or Erin can speak to this around the whys, but your body is not in a very good position. You got weight and things like that on it. So make those adjustments, help yourself out, and prevent chronic and overuse injuries simply because the ergonomics of your bike is just not ideal. I can't stress that enough. I would say literally 99% of my students would show up with a bike that was not properly set up for them. So it's a thing, right?
Yeah, I would second that for sure. I see the same exact thing in my adventure classes. People come in with all kinds of wonky stuff for they're traditionally, for example, they're traditionally seated riders, and all of a sudden they want to jump into the adventure world, but they don't make any of the adjustments for a standing position, and they are awkward, but really trying to muscle through things instead of being able to finesse. I found the finesse piece in being able to get myself back in the saddle when managing the weight of a huge bike while I'm also still rebuilding my body has been really tough. That I know not everybody has the opportunity to just run out and buy a dirt bike, but if you can borrow a dirt bike, or you're in Virginia or you want to catch up with me while I'm traveling with the bikes, I'd be happy to get you on a dirt bike, because that has been the best thing for my riding that's gotten me back in the saddle, where I can practice the movements without managing my body weight plus the bike's weight and that higher risk of, tip overs that I get squished under instead of tip overs I can step off of, or things like that.
Love it. BJ, did we finish everything up with you and getting back on the bike and all that kind of stuff before you had to move into exterminator mode?
Yeah, I think so. Yeah. And I'm happy to answer more questions and get back on track in the chat. Sorry for the interruption.
No worries. I think everything that you gals have been speaking to so far, from like understanding injury, understanding the process of recovery, being patient with yourself, all of the back and forth that's going on in the chat is so cool right now, because it really is such an individual process. And it's like, once you've gone through the process of getting yourself injured, doing all the right things by your doctor and your PT, and moving forward with all that stuff, setting up your bike so that you can ride comfortably, even if you have some kind of physical compromises, I think what all that leads to is truly rebuilding confidence and getting back into that headspace that you need to be to deal with these big bikes or even small bikes off-road and challenging terrain. So I don't know whose slide this is, but I would say take it away.
Yeah, I think that was me. At least part of it. The one of the things that that has also been very helpful to me is getting out and actually practicing, setting up little tiny practice sessions. I, for one, get super overwhelmed if it's just going from PT, couch time, winter sleep, all that stuff to all of a sudden I'm going to go do an epic trip. I think Shal touched on this earlier that, setting up some small doses. For me right now, trying to get back in shape, for my ride time ends up being mostly in the winter for my personal riding. And I'm like, it's so hard to be consistent. Oh my God, I'm never getting to the gym for that 2-hour session. So instead, I'm trying to do 20 minutes every day or 20 minutes 5 days a week, but trying to shoot for consistency. Same thing on my motorcycle. I'm going to go out and do some practice balance drills in the garage. I'm going to do 5-minute practice sessions in the driveway. And instead of, okay, I'll take a warm-up lap and do a couple figure eights before my 8-hour ride for the day, setting aside that kind of time is something that I can personally say is awfully hard to do, because when I finally get a chance to go ride, I want to go get after it. But the practice stuff helps my body start remembering how to do things. And in terms of knowing, and I'd love to hear from everybody on the panel, like, how do you know when you're ready to ride again? For me, it was the absence of pain. That was like the huge one. And even then, mostly it has been psychological. That having, and I saw somebody in the chat using the word grace, having some grace with myself to be like, all right, I'm scared. Today's just a day that I'm scared. That sucks, but okay, good job, scared self. You went out there and did your half an hour anyway. That kind of thing. And I don't know when I'm ready to ride until I go out and try it. So I try to save time before I need to make that go, no-go decision. What do you guys think? When do you know you're ready to tackle trails or certain terrain again?
You never feel ready, right? Because being ready is not a feeling. It's not an emotion. It's a decision, right? So you have to kind of, the way I see it is baby steps, right? Just kind of start small, and maybe it's just 5 minutes sitting on your bike in the garage until your breathing gets normal again, and you're like, oh, okay, nothing's killing me. Or maybe it's only uncomfortable at a level of like a 1 or a 2. That's kind of where I start.
Well, when I heard BJ say that you're ready when you have the absence of pain, I kind of chuckled inside, because I would never ride.
Right.
So sometimes, you have to deal with just the acceptance of discomfort and the new norm. And my body will never be the same. So, sometimes it's you got to be headstrong. Not saying that BJ's not headstrong, just like,
right.
not saying that at all.
Sometimes it's pushing through, and it's let pain be your guide, but also let that fear guide you a bit, and it's just stepping back on the pegs while the bike is parked and on the side stand, and just sitting in the saddle like, oh wow, this can be intimidating too. So maybe it's finding your tribe, finding your people, and those who understand what you've been going through that can help you. It's nice to be with someone else that it's like, oh, okay, they know I've been injured, and they know I have this fear, and we're comfortable just doing this small dirt gravel for 10 minutes, stopping and taking a break. Like, having grace for yourself, and then finding the people that also can do that for you is helpful.
And I certainly didn't mean to imply that I'm not in chronic pain too, but I meant when like the acute phase is over,
okay.
when I know the graft is finally healed to the bone,
Right.
lack of pain.
Correct.
Yeah.
Yeah,
I mean,
yeah.
we're all in what, our 40s, 50s, and beyond. Of course, we have pains every day.
Right, right.
I love it.
Absolutely.
Awesome, ladies. So we've got a little bit of time for Q&A. There's a few questions in there, but just to everybody on our panel, you guys, girls, thank you so much for sharing everything. And don't hesitate to jump in right now. We do have a little bit of time. We've got a couple questions that I want to bring up, but I know that there is so much here. There's so much to this recovery process. And I think I love what's going on in the chat, because we all know that, like, when you're in a lousy position, whether you're injured or bumped up or having a hard time with life in general, that's not permanent, right? That break is not there forever, right? Like, that hard thing is not always there. And so I think just like always having that little bit of faith that we're going to be able to move beyond that. And I think, like, it's hard when, especially when it hurts, but it's just been so cool to see you all just encouraging each other over in the chat. So keep those questions coming. We do have a few minutes, and girls on the panel, if there's other stuff that you need to say, like, don't hesitate to jump in. But I'm going to start with one question that caught my eye earlier. Do you have any supportive studies that you can share, that I can share with my PT? And I feel like that's one of those things that I think about a lot in this day and age, where so often we have to take our own medical care into our own hands, be our own advocates, despite the fact that we have the medical system. So maybe you gals can speak to that, some of those studies, how to support yourself and be your own advocate.
I will tell you that is an excellent question, because you need to be curious about what's going on, and be prepared when you go to your appointments, because healthcare workers are burned out, and it can be very, very, very hard to really get their attention. At the last outpatient I was working at, I was seeing two patients at the same time. Like, how am I supposed to give care to this person and this person at the same time? So being prepared and asking those questions is really good. There are thousands and thousands of research articles that come out every year. So that's a really broad question. I'm sure there are plenty of articles that we could find. And the quality of those articles can be from really, really not great. Someone just used ChatGPT, and then you have systematic reviews and your meta-analyses that have, like, really awesome updated information. So there are also something called clinical practice guidelines that are updated for physical therapists. So those are something that your PT can find. CPG, clinical practice guideline. So they have them for all sorts of things, like cervical pain and headaches and all sorts of things. So that'd be one thing to kind of dive into. So I can help with that. I don't know what I have access to anymore, and I'm sure I can find information, but it's ever changing. So that's my soapbox.
And
does this sound like something a conversation that could happen in the Facebook group? I bet it could.
Absolutely.
It could. Absolutely.
Please ask.
And the other thing that I want to say is, the scope of medicine now is so big, and you're never going to have one provider who knows everything. There's nothing more that I like than a patient who comes in with studies and questions and a Google search. Genuinely, it makes my job easier, because I know what they're looking for, and I'm learning something right along. I'm like, oh, is this red light therapy is a bunch of woo-woo. Oh, wow, look at that. 50% increase in muscle in sarcomeres. Wow, that's real. So, finding that stuff. And I will tell you, physicians love white papers. They love researched, peer-reviewed articles. They don't love AI, because AI is not always correct. At least in medicine, the stuff I've seen isn't always correct. But a white paper, it helps a decision between you and your practitioner. And that's what it should be. It should be a shared decision making with you and your practitioner about what the risks are, what the benefits are, and what you're looking for. You're looking to be able to get your leg up over that motorcycle. You're looking to be able to tuck that knee better. These are all conversations that you should be able to have with your practitioner. And if you can't, find another practitioner.
Love that. Awesome. Next one, this is just Eva's personal Q&A session here. I'm just picking all the questions that I'm most excited about. And this one is really relevant to those of us in our 40s, 50s. Someone said, yes, we seriously need to talk about perimenopause and how so many of us are moving forward. And one of you mentioned something about hormones earlier at some point as well. So maybe either from the clinical perspective or the mental perspective, what's What's up with perimenopause and menopause, girls?
So there's actually a super interesting white paper that just came out, and it's called the musculoskeletal syndrome of menopause. This is a real syndrome that we're seeing with women when estrogen decreases, when testosterone also decreases, and what happens to the connective tissue for women. Women are at a much higher risk for frozen shoulder. They're at a much higher risk for osteoarthritis, and it has to do with some of these tissues. I will send a link out to, it's Vonda. Her name is Dr. Vonda Wright. I'll put it in the chat. She's got a white paper on this. It's really, yeah, we're learning a lot more.
That
really
would,
practitioners.
yeah, that would be really, really great to read and even just have like a little synopsis. Oftentimes we're seeing women with osteopenia, so that means low muscle mass and osteoporosis. What's the one before osteoporosis?
Osteopenia and sarcoma.
Sarcopenia,
Yeah.
osteopenia, brain. It's bedtime. But low muscle mass, you have decreased muscles, then you have weakened muscles that are not pulling hard on bones. Bones are an active tissue that are always growing. So you get input to your body, you can strengthen these things. What happens in perimenopause is that estrogen goes down, and so we don't get that bone building response. We get more of a bone breaking down response. And you see this with I think certain medications as well. And so those of us in our 40s, 50s, 60s, where our bones are getting more and more brittle, and we have to have hormones in order to supplement that. But you can also make impacts by getting some physical activity. You jump up and down in place 30 times, that's going to help your leg bones grow. And that's, depending on kind of like where you're starting. So that is a great topic and something we should absolutely address, and something that we should have in mind as we get older. Just because we're 80 years old doesn't mean that we can't get stronger.
Right. And again, to Jess's point, muscles, bones, and ligaments, they love tension and stress. It's what makes us stronger. It's kind of like, do you remember a couple of years ago, maybe a decade or two ago, there was that experiment where they went and they lived in the biodome, and all these people decided to go live inside this glass terrarium, essentially. Well, interesting, all the trees fell over. They all bent and fell over because they had no wind. They had no stress against them. Our bones and our tissues are the exact same way. We need that stress. You need to be jumping. Now, again, as a 50-something-year-old woman, do I want to be jumping like crazy? Probably not. But am I going to make sure that I get some impact in? Yeah, because I want my bones to be strong. It really makes a difference.
And that's where PTs, coaches, trainers come in to help you find out where you're safe starting and progressing through there.
Correct.
Absolutely. Great question.
Super good question. You know what? Just in the interest of time, I'd love to just hear a last little bit from BJ, from Shal, Erin, and Jess. Just a couple things to keep people encouraged, keep people stoked as they're recovering, or sloughing off that fear of injury or that fear of getting back on the bike.
It's winter. Try to get as much sunlight as you can and try to be happy. Injuries happen to everyone. We're all in pain. You sit too long and you can be in pain. So it's about identifying that and trying to get to a point where you can manage that pain and try to build your function and lean on each other. That's boop.
I love that.
Hit us up.
I guess for me, I would say you're what you think, right? So that's another big thing. If you're hurt and you're constantly like, I'm hurt, I'm in pain, this is horrible, I'm terrified, and all those things can be true. But if they're taking over the recording and they're really setting down a neural pathway, you need to deliberately start to break that with a phrase or a catch-all that is true, whether I'm getting stronger, I'm working harder, I am building this, I am improving, where you have to just change some of the brain chatter in, not only in your riding, but in your recovery.
I love that, Erin. For the first year or two, literally, I had a mantra. And anytime things got really challenging, whether it was mentally or physically, I would say strong, fit, and healthy, strong, fit, and healthy, strong, fit, and healthy.
Yeah.
And it was, I mean, it was my go-to because that's where I wanted to be. Right. And so I wanted this reminder, and I literally would chant it often.
Love those. Yeah, I need a mantra for sure because I'm kind of a bitch to myself in my head. It's downright cruel up there. Um, so the advice that I have, because I need to take it, is that mobility, yoga, that kind of like nerve gliding exercises, stuff like that matters. That part counts for me at this age just as much as all my heavy lifting and cardio and trying to get jacked and strong really doesn't work very well for me anymore if I'm not supple. So I'm just kind of like embodying supple in all aspects. How I talk to myself, I need to be more gentle there, how I work out, it needs to be more gentle. The supple goes well for me with how I want to be on my bike too.
Love that. Love all of that. I said that everyone was going to roll out of here enlightened tonight, right? Because that's what it all comes down to, right? Is like being kind to yourself, being fluid, going with the flow, all that kind of stuff. Ladies, thank you all so much. So much good information. I know there's some stuff getting dropped in the chat. I see some stuff about hormone testing and some menopause stuff. Any of those links that we have, like throw those in there. Those are so cool. When we put out the poll earlier, results are in, ladies. 48% of you have had shoulder and or arm injuries. 43% have been having some knee injuries at some point in time. Feet and ankles are at 39%. And then down low, hip, torso, head, and neck, all sub 10%. So keep it strong, keep it healthy, ladies. So awesome. Do enjoy the season. Don't hesitate to jump on the SheADV store if you need gifties for anybody, particularly yourself, because you look fabulous in everything that we make. You can always donate. You can join the supporter program. Lots of good stuff on there. A bunch of discounts for all the riding gear that you don't own yet is on there. We have this awesome map that I'd love to see more of your names on. And yeah, long story longer. You girls rock. We wouldn't be here without you. I mean, what is this, 3 years of doing Trailside? Is that true? That is crazy. And all we do is take July off so we can ride our motorcycles. Girls, this is just so cool. Thank you all so much for being a part of it. Thanks for wrapping up another amazing year with us. Everybody who's out there, you girls are the best of the best. Take a break, get that good sleep, protein for breakfast, all those kinds of things. If anybody has any bumps and bruises, I hope you're doing a good job of taking really good care of yourself. And thanks to everybody on the panel tonight. You girls rock, and everybody who's a part of this community. It really does mean the world to us at SheADV that y'all are here with us. So that's all from me, ladies. We will see you in 2026 when we can really start getting stoked for that big giant riding season ahead. So thank you all so much, ladies. Have a wonderful night. Enjoy.